What are some specific things that are helpful to tell a hair transplant surgeon in terms of your goals? I could draw a hairline, could mention that I'd like to frame the top middle of my forehead and have noticeable temporal points. Ultimately, I'll probably get 3 or 4 FUT hair transplants in my life, and I don't want to look too weird in between stretches. What are some specific things that are helpful for a patient to communicate to you? I don't want to walk in and just see for my goals. I don't know. What is the best in the long term? I'll settle for that. What do you think?
Thank you for your question. You submitted a question without photos, but I think it's interesting how you're phrasing the question, and basically you want to know how to appropriately guide your prospective hair transplant in the way to do your transplant. You also describe in your question that you anticipate doing 3 to 4 transplants, which seems very optimistic and realistic to a degree. Well, certainly I can give you a little bit of guidance on how I discuss this question with my patients. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan for over 20 years, and I have been doing hair transplant for many years, as well as I'm also the founder of TrichoStem Hair Regeneration Centers, which may be of interest to you because this is part of a strategy that actually was derived from helping improve hair transplants. So to begin with, it's good that you want some guidance, but I think the ultimate reality is understanding what the limitations are in your situation. When we discuss hair transplant with the patient and when we're planning a procedure for that day, basically I look at the area of the back of the scalp of the hair and I count an average of what the density is in a given area. So that's my area of harvesting. The higher the density, the more hairs you can harvest. Also, what's factored in is the quality of the hair in terms of caliper. Fine hair versus thick hair, straight hair versus curly hair or wavy hair. And then comes the optimal place to place the hair. Now this is where you have to do a little bit of a projection as to what your hair will look like if there is no intervention to stabilize hair loss. And that's where I think there's opportunity. When you go for a hair transplant, understanding that if you continue to lose your hair, you will be chasing the results until you run out of donor. The donor area is a limited bank, and the geometric space of the scalp is much larger than the limitations of the donor area. So it's about strategy. So for men who will say, I want my hairline moved forward, that is a problem because that can be a challenge, especially if it's an unrealistic level. As a general rule, it's about 4 finger breadths above the eyebrows is where the hairline starts. But I'll introduce you a little bit to what we tell our patients before we even begin with transplant. The majority of men who come to our practice with the interest in hair transplant are men with thinning hair. Well, for men with thinning hair, we have a treatment called hair regeneration. Hair regeneration is a non-surgical alternative to hair transplant for men and women with thinning hair. And what we're doing is we're combining acellular matrix, which is used for wound healing, with platelet-rich plasma. This combination and a special method and placement system that I've developed allows me to actually get coverage for, in the right candidate, the equivalent of 2 hair transplants. It sounds too hard to believe, but it actually has been my objective observation based on decades of doing hair transplant. The problem with hair transplant, especially if you have existing hair, is there is collateral hair loss. When you are working in areas where there is existing hair, placement, let's say you say 1,500 grafts, you're making 1,500 holes. Well, when you make 1,500 holes, you are going to traumatize and lose a certain number of your existing hairs. Before hair regeneration, we all accepted this as part of the reality, replacing a dying or thinning hair with a thicker hair. But now with hair regeneration, we have the density already there, and we can make those hairs thicker and get better coverage. Once you're able to stabilize hair loss and maximize whatever is your potential, then a hair transplant becomes a more rational treatment because now you're dealing with a more stable canvas. So when you meet with doctors, I would recommend that you get a rational understanding of what the realistic outcomes will be with transplant, and learn more about stabilizing your hair loss with medical treatment as well as a treatment like hair regeneration. Incidentally, we found that when we have patients who come in with thinning hair who are considering hair transplant, they'll actually, once we do hair regeneration, most of them don't go further and are very happy with the hair the way we've been able to help them. So they're able to avoid transplant altogether. But with hair regeneration, the earlier we catch someone, the better it is. So I hope that was helpful. I wish you the best of luck. And thank you for your question.